It's now 7:15.
Middlemore Hospital says it's done well from a government funding boost of $80 million, despite County's Manukau District Health Board estimating a year back that it needed more than $1.5 billion to upgrade all its facilities. The funding will be put into 4 projects at the South Auckland Hospital and the Manukau Superclinic. $80 million, though, compares to earlier funding announcements for other DHBs. Auckland Hospital got more than 3 times that, and North Shore got $200 million. Well, here to discuss this is the Minister of Health, David Clark, who's with me here in the Auckland studio. And good morning to you, Minister.
Good morning, Guyon.
Thanks for coming in. Your press release says, quote, that the long-standing problems with buildings and infrastructure at Middlemore Hospital and the Manukau Superclinic will be fixed, end quote. So will this money be enough to fix Middlemore Hospital?
There'll be plenty more that'll be required over the next 10 years. We know that's true around New Zealand. We've got seismic issues in buildings. We've got lifts at Auckland that need repairing. We've got all kinds of plant that's aged and decrepit in different hospitals around New Zealand. So that's one of the reasons we committed the $750 million in our first budget and sent a signal that we intend to fund health infrastructure properly again.
So will this cash injection that you've put in, the $80 million, fix all the rotting buildings at Middlemore?
No, there will be more that will need to be dealt with, I have no doubt, over time. The Kids First building is the first one off the block after the Scott building. They needed to pull the Scott building cladding off to really understand what was going on underneath. That will help with the final business cases for other buildings, and we'll work our way through the problems. Guyon, it's probably important to note that many years under the previous government, no funding at all was put aside for capital. So any one of these announcements you've just canvassed would have constituted a big announcement by the previous government. We're doing a whole bunch of them.
Well, OK, but you've criticised the previous government for underinvestment. That has been a constant refrain. I wonder whether you're not doing the same, because by your own admission here, the money that you've put in, the announcement, will not fix all the rotting buildings at Middlemore. And in fact, this leaves, doesn't it, the Manukau building and the Superclinic as rotting buildings which are unaddressed by this announcement.
Yeah,
is that true?
We will work our way through the business cases as they're ready. The DHB will work with the Ministry of Health to finalise business cases. We're taking these things one step at a time. Taxpayers expect us to spend this money carefully and in full knowledge of what's wrong in each building, and so we're stepping our way through one at a time. It will take time, Guyon. There's no hiding from that.
Well, the report from Alexander's & Co to the Manukau District Health Board said that the first priority was the kids building, but second priority was the elective surgery centre at the Superclinic, and they wanted work to commence in early 2019 on that. And as a third priority, the Manukau building, they wanted work to commence in early 2020. These are the engineers. So how come you've left these 2 rotting buildings, which are seen as top priorities?
Well, the business cases aren't ready for all of these things yet. That's the reality. The DHB steps through them one at a time. They've now got the funding certainty, this $80 million, that will help them to finalise those business cases. We're going to make our way step by step through these investments.
So you're comfortable to leave those 2 rotting buildings?
Look, I'm deeply uncomfortable with what I've inherited across New Zealand in terms of the building infrastructure. We've also got to be realistic about the workforces to deliver on this work. So, $750 million, even as we announced that in our first budget, we're mindful if we put more money into it, the workforce might not be there to deliver on the projects.
So when you say the business case isn't done for it, what do you mean? I mean, they've identified the problems with it. You've had engineers crawling all over this. Yeah. Why can't, given the problems have been identified and given they are pretty serious problems with pretty critical pieces of infrastructure, people's lives, people's health, why can't we get on with it?
Well, the work has to be done carefully. We actually have to know what is likely to be the cost. Contracts have to be let, and they have to be done off a pretty sound basis. We can't just say we're going to put this money aside and we'll wait and see what happens. We step through with engineers, with others, to finalise projects before we fund them, and that's a pretty normal process. It's done in conjunction with the Ministry of Health, and then it goes through a further sign-off with the Capital Committee that oversees all investments across New Zealand.
For the $80 million, has a business case even been done on that?
The business case is not quite finished yet for the $80 million. There's still work going on. This just gives a degree of certainty.
Because you're saying for the $80 million, you haven't even put a business case together. Why have you announced it?
Sorry, it's the DHB that puts a business case together. They're working on that. It's nearing maturation. and this gives them the confidence to carry on and know that these investments will be next. We made a pledge that we wanted to address these issues, and we're giving some confidence to the DHB that we're going to get on with it.
Why have you only put 10% of your capital health budget into Middlemore?
Well, some of the big investments this time around are regional investments, and the DHBs have worked together. And I do salute them for that across Auckland. Auckland at the moment is getting the bulk of the funding that's been allocated, but you'll see that the funding for Auckland DHB. Well, we know Auckland DHB is the major tertiary centre. Starship Hospital serves the whole of New Zealand, and so patients move between the DHBs and they share the services. The elective capacity that's going to be built at Waitemata will take load off other parts of Auckland. This is actually a really good process, and they've put together a long-term plan which will underpin the thinking for years to come across those DHBs, and I really do commend that work. There will be changes as we work through the detail of the business cases, but some really good thinking has gone on already.
So when will you have the money on the business case and be ready to fix those other two leaky buildings, the Superclinic and the Manukau building?
Well, look, I can't give you a date for that, Guy. I'm
roughly.
dependent upon.
Not after a month and a day.
I would be wanting to see them within a year. I'd wanting to see progress on those things.
So you are going to put extra money in the next couple of budgets, are you, to fix these buildings up?
I of course don't get to decide the final allocation for health. The Minister of Finance has that privilege, but I will certainly be pushing for money for capital projects.
Because that's the point, isn't it? You've got spending as a percentage of GDP down to 20%. Debt as a percentage of GDP down to 20%. So it seems strange that you're struggling around for extra money to fix rotting buildings at Middlemore, having made a massive play about how this was indicative of underinvestment by the last lot.
There is a couple of things we're trying to do with that debt thing. One is to make sure that we're prepared for international shocks or events like mycoplasma bovis that came up after the budget allocations were finalised last time. We need to be prepared for a rainy day or an earthquake or for global shocks.
This is a rainy day, literally a leaky day, isn't it?
Sure.
For these buildings. I mean, it doesn't get much more important, as you've indicated, than rotting buildings in a hospital.
And the second point is the workforce point that I made earlier. You can't simply fix everything at once.
Do we not have the people to do it?
Well, the workforce will be building up. $750 million that we announced in the last budget is the biggest allocation in about a decade in capital terms. So we are asking them to stretch as workforce, as a construction workforce, to deal with some of these issues, and we're going to expect them to grow as well as we fund into the future.
They said they needed $1.5 billion a year ago, and you've given them $80 million.
Yeah, over the next decade, the Treasury's best estimate is that across New Zealand, around $14 billion will need to be spent on health projects.
Okay, but let's focus on Middlemore, because that's what the announcement was. I appreciate that that's the broader context, but they needed $1.5 billion roughly, and you've given them $80 million. Now, I know it's a start, but it's a very small start, isn't it?
We will need to fund these things step by step as the business cases come in. Look, these are eye-watering amounts. There's no getting around that. There is a significant amount of money that needs to be spent on infrastructure to ensure we have the public services New Zealanders expect.
What did they ask for?
We haven't got the final business case, but look, that won't be a point of contention.
Why have you made the announcement without the final business case?
Because we wanted to give them confidence around this process. I know they're nearing maturation. We did want to make sure that people knew we were intending to fund this project.
Let's say the business case comes back and says we want $200 million.
One of the other things that's fed into it, I should probably have pointed out, is the cladding is coming off the Scott building now, so we are able to know a little bit more. This was one of the reasons why all of these projects weren't progressed earlier, because they have to take the side off one of the buildings to actually understand what's happening behind those walls and to better estimate what the costs will be for the subsequent buildings.
And so you'll get the business case when?
Soon, I hope, Guyon, very soon.
Thanks very much for your time, and thanks for coming into the studio. Do appreciate that. That's David Clark, who is the Minister of Health. Be interested in your feedback on this issue, the story and the details. 21001 is the text message to reach us on. Morning Report at radionz.co.nz or on Twitter, NZ Morning Report. It's 7:25 now.
And rain in Otago overnight hasn't resulted in any more flooding.